You got your annual checkup. They checked your cholesterol, blood sugar, maybe blood pressure. You're healthy, they said, but you're tired. You're gaining weight. Your libido's gone, and you're aging faster than you should. That's because the tests they ran don't show the full picture. I'm Dr. Richard Visser, and in this episode, the Visser podcast, we're diving into the blood work that actually tells you how long and how well you'll live. Let's talk ApoB, insulin, thyroid, testosterone, and the functional markers your doctor probably never ordered. The standard panel is useless for longevity. Total cholesterol, LDL, HDL, fasting glucose, that's 99% of the annual panel for most people. And it misses the early warning signs of disease, burnout, and decline. You want to optimize your health span? Then you need to test like someone who's serious about performance and prevention. The functional longevity. Plaque. ApoB, the particle count that predicts plaque. You need that test. More predictive than LDL. ApoB measures the actual number of lipoproteins damaging your arteries. Second one, Lp(a), the genetic time bomb. You do this test once. Most of you haven't done it. 1 in 5 people have high Lp(a), which increases risk of stroke, aortic valve disease, and heart attacks. Most docs never test it. Fasting insulin, HOMA-IR, catch diabetes early. Elevated fasting insulin equals metabolic dysfunction, years before blood sugar rises. Add HOMA-IR to calculate your insulin resistance. This is what prediabetes really looks like. HS-CRP, inflammation that destroys you silently. Listen, we talked about this. When you have the perfect storm, you've got prediabetes, you got inflammation, you got ApoB or Lp(a), then you're really down the shitter. Together, coming together. All right? This is the perfect storm. So we need to check for this, and your doctors are not doing it. Not with the tests they're asking. So, HS-CRP, inflammation that destroys you. If this is elevated, your body is undergoing chronic stress. It's predictive of heart disease, brain disease, and even depression. Number 5, triglyceride, HDL ratio. The metabolic mirror. This quick ratio is one of the best markers for insulin resistance. Under 1.5, great. Over 2, you're on the path of metabolic trouble. Okay, the hormone panel. Energy, muscle, libido, longevity. Hormones run the show, especially as you age. Here's what I check in every client, okay? Here goes for men. Total testosterone, free testosterone, most important one, estradiol, E2, SHBG, sex hormone binding globulin, DHEAS, IGF-1, growth hormone markers, LH, FSH, this is for the testicular function. For women, 35 and plus, this is what we check. Estradiol, of course, E2, progesterone, free and total testosterone. Yes, women have testosterone too. It's on a much higher level, but they still need it. DHEAS, FSH and LH, SHBG, IF1. Why? Because low hormones equals mood swings, weight gains, fatigue, low libido, muscle loss, brain fog, bone density loss, and they often go missed because symptoms are chalked up to aging, stress, perimenopause, menopause, whatever you want to call it. Okay? Here's a kicker. The thyroid panel. Your metabolic engine. Fatigued, cold hands and feet, gaining fat, despite a clean diet, might be your thyroid. But there's the problem. Most doctors only check TSH. That's like measuring fuel pressure without checking if the engine is even running, okay? get the full picture. We need the TSH. We need free T3, free T4, reverse T3, thyroid antibodies, okay, TPO, TGAB. Why? T3 is your active hormone. That's the one that makes shit happen. Reverse T3 blocks it. So antibodies catch autoimmune thyroid disease early, like Hashimoto's, okay? What I use at Vera, the full panel, inside Vera Doctors and our cell to soul longevity lab, every high performance patient gets ApoB, LP(a), fasting insulin, HOMA-IR, HSCRP, full lipid metabolic panel, full thyroid panel, full hormone panel, ferritin, GGT, ALT, VO2 max, DEXA, BP trends, biological age, and body composition. Critical. This is the top of the line. Because if we're going to prevent disease, we need to see it coming 20 years in advance, and we can with the right tests. Okay? Your next move, this is your health dashboard. It tells you how fast you're aging, how hard your heart is working, how balanced your hormones are, and whether your metabolism is friend or foe. You don't need a diagnosis to demand this. Order it yourself. Ask your practitioner or come to us at Vera. Just don't wait for symptoms. Prevention doesn't happen after the crash. Okay? This episode was just about labs. It was about taking your health personally, because no one's coming to save you from the aging process. Not your doctor, not your insurance, especially not your insurance. But with the right test, the right training, and the right protocol, you can turn this clock back. I'm Dr. Richard Visser. This is the Visser Podcast. Subscribe, leave a review, send this to someone who is being told their normal blood work means they're healthy. We don't guess, we test. See you in the next episode.